honored to introduce our next speaker, Vaidya M. Prasad sir. Sir is a native of the central district of Thrissur, Kerala. He completed his graduation in the year 1996 from Vaidya Ratnam Ayurveda College, Ullur, and post-graduation in 2002 in Shalakya Tantra from Government Ayurveda College, Thiruvananthapuram. In the year 2006, he established Sunetri Ayurveda Ashram and Research Center in Thrissur for propagation of Ayurveda specialty in the field of autism. He has been working for autism spectrum disorder since 2002 and has developed a Sunetri protocol for the same. He has been awarded Bharadwaj Puraskaram in the year 2015. In the year 2013, Dr. N.V.K. Warrior Memorial Ayurveda Pracharan Puraskaram by Ayurveda Medical Association of India, and many more. Vaidya M. Prasad sir served as the principal and medical superintendent in Ashtangam Ayurveda Chikitsalayam and Vidyapidam 2015 to 2020. With this, he learned the principles and practice of Ayurveda under legendary Acharya Padma Bhushan, Vaidya Bhushan, R.K. Raghavam, which he continued for 21 years and got trained in clinical Ayurveda under Padma Shri Dr. Raj Gopalam. Recently, in the year 2021, he is appointed as Guru for the CRAU program by Rashtriya Ayurveda Vidyapit, New Delhi. I welcome sir on stage.
Chaturmukha samarambham vagbhadacharya madhyamam asmadacharya paryandam vande guru paramparam ragadirogan satatanushaktan asheshakaya prasrutan asheshan aulsukya moha aradidan jaghana yopurva vaidyaya namostu tasmai. Humble pranams to all of you, dignitaries, legendary Vaidyas, senior physicians, and lots of young faces, students. First of all, I would like to thank the organizers, especially my friends Vaidya Ashutosh and his wife Vaidya Isha Nanal for this invitation. This is for the second time that I am participating in this extraordinarily informative conclave. I am supposed to talk on a specialty topic called autism spectrum disorder. Fortunately or otherwise, we are working on autism spectrum disorder for the last more than 22 years. It was really a very wonderful experience, and it is continuing to be so. Meeting a lot of parents from various parts of the world and travel with them in the healing process of their children affected by a sort of new age disorder. And in the last 20 plus years, I have tried, or we have tried, our institution have tried to develop some sort of a protocol how Ayurvedic Vaidyas can approach the autism spectrum. And I was listening to Dharmadhikari sir while he was talking about the Anukta Vyadhis, importance of Nidana, Swatantra Paratantra Vikaras, and how important is the proper understanding of the condition from an Ayurvedic perspective. What is the importance of Hetu Viparita Chikitsa, Vyadhi Viparita Chikitsa, where to go for Shodhanam, where to go for Shamanam, all those things. Such an enlightening talk from such a knowledgeable, learned senior Vaidya. So while listening to him, I was just translating those ideas to what we were doing while addressing the topic of the day, that is autism spectrum disorder. And while standing in front of you, such a wonderful audience, I am overwhelmingly dedicating myself, or this talk at least, to the fond memories of my Guruji, Vaidhyabhushanam K. Raghavan Tirumulpadu, with whom I was lucky enough to learn the basic principles as well as the application of the basic principles in clinical situations for almost 21 years. So my pranams to my Guruji. Now I'll be introducing the topic first. This is a very interesting one and very technical one also. Because as such this is an anukta vyadhi. There may be traces of many things. Sometimes you may be finding some traces of ojakshaya, sometimes some unmada, sometimes some aganduja unmada, or what we call as this graha or balak graha. Many shades can be seen when we go through this interesting clinical situation. And as the name shows, it is a spectrum disorder. The Varnaraji is what we call as spectrum. It is quite diverse. Previously, or even now, I think certain terms are widely in use, like pervasive developmental disorder. Its nature itself is that pervasiveness. So technically it is a complex developmental condition. I hope the slides are quite clean and visible. It is a complex developmental condition involving certain persistent challenges. I will not go to the very fine details and all the technical slicing of the topic, because it is not necessary many a times. These are more about the textbook purposes. So this developmental condition, which involves persistent challenges with the social communication, that is one core area. Lack of social communication. There are many interesting reasons behind this, which we can see later, especially after our pandemic lockdown. I think even the human history should be divided into two: pre-lockdown period and the post-lockdown period. That sort of a change has happened in our behavioral pattern. Then restricted interests. The child shows very restricted interest, and a behavior of repeating things, repeating certain activities. So that repetitiveness, when you have very limited interest, you will be spinning around it all the time. And doing things, saying things, working on various activities repetitively, no change. This DSM-5 is the internationally accepted manual for the diagnosis of this psychiatric type of illnesses or conditions, and it defines autism spectrum disorder as one disorder, please listen, as one disorder with 3 levels of severity, mild, moderate, severe, for each of 2 core symptom categories. So, 2 core symptom categories, that is social communication impairment, number 1, number 2, restricted repetitive behavior, RRB. And there should be symptoms from both the categories. If there is only from one category, you cannot technically diagnose the case as autism spectrum disorder. So there should be representation from both the categories, and then also it is considered as one disorder, and it can have 3 levels of severity. Now, regarding the social communication impairment, social emotional reciprocity is lacking. See, I am seeing somebody, I am saying hello, hi, there is no response. The other person is not even looking at me, or not even interested in looking at me, or not even interested in acknowledging my presence. Then problems with non-verbal communication. As social animals, we have many modes of communication. Verbal communication is one among them. See, even while I am talking, I am saying that verbal communication is one among them. So when I use my finger to show that one, this is a mode of communication. I am seeing somebody, then immediately I am, wow, I am just arching my brows and wow. Now you cancel off that sound. Still it is communicating. The same thing is communicated. It's a non-verbal communication. See, even now talking, I am using my hands many times, this way, that side. So that is lacking. The understanding relationship. I have seen kids who will say appa, amma randomly, but he is not familiar or not sure who is the appa, who is the amma. Just saying some words, appa, amma, tatat. So, not understanding the relationship. Then, coming to the RRB, repetitive motor movements, just moving the neck, something like that. While I'm talking, I'm just checking my hand, bit excited, hand flapping. How many times? 100 times? 500 times? So, repetitive body movements, which may be quite strange at times. Putting the fingers in front of the eye and looking at it repeatedly for minutes together. Then, inflexible to change. They prefer some sort of a sameness, getting up first. Then, it goes to some level of a obsession, getting down from the bed through the right side of the coat. They can't do it on the left side of the coat. If you force one day to take him out from the left side, no, he is upset. He has to get down from the coat through the right side of the coat. Then there is a chronology of events. First, going to the washroom, then brushing the teeth, then taking some. So, if you make a slight change in this chronology, he is upset or she is upset. They can't tolerate it. Then very restricted interests. He is happy with maybe holding a small piece of eraser. So to get up in the morning and the first thing will be to search where is that eraser piece, holding it. Then he is comfortable with that piece of eraser for the whole day, nothing else. Or doing one particular puzzle, or listening to one particular song. How many times you can listen to a song a day? 10 times? 50 times? That is finished, replay. Replay. And sensory, many a times hypersensitivities. Can't tolerate certain frequencies, can't tolerate certain touch. Somebody is coming and trying to hold him or hug him. That emotional hug, he feels as you are going to kill him squeezing. That hug he reads as quite suffocating. Or a touch on the head, he can't tolerate. Cutting the nail, trimming the hair, using a dress of a different texture, one particular smell. They can't bear with it. It is intolerable. So these sort of sensory issues. And there can be many, so these were the diagnostic parameters, whereas there can be many other issues. Irritability, getting upset for very silly reasons, and anger, violence episodes, burnouts, many things. Then impulsivity. What is impulsivity? What is impulsivity? He thought of doing something and that will be done right away. If it is to jump from the top of a very high furniture, that moment he will jump down. If he wants to push another child, that moment it will be done. Next moment he may say, or he may express some sort of a regret. But at that spur of a moment he can't control. He will do it. Anxiety, new people, new place, new activity, new sound, everything can make him anxious. Even a new food can make the child anxious. Attention deficit and hyperactivity. That itself is another clinical entity now. Attention deficit hyperactive disorder. They can't sit idle even for a second. They'll be doing something here, taking this off, then somebody rushes, immediately they will go to the other side, then somebody, next time they will be climbing on the window, then next time they will be on the handrails sliding down. And because of this hyperactive nature, they can't focus on any single task. So, attention deficit, lack of focus. Executive dysfunction, learning disorder of again a big spectrum. So many things of that sort. Then the diagnosis can have different specifiers. A specifier means an extension to the formal diagnosis, like ASD with intellectual impairment, ASD with language impairment, ASD with another medical condition like epilepsy, and so on. then why should we discuss this? The patterns are changing very fast. Years back, I think it was in some 94 or something like that. Very interestingly, we decided to, in our hometown, for some strange reasons, we decided to conduct one seminar on multiple sclerosis. And as per the protocol, we went to a neurologist and invited him, sir, please come and give us a keynote address on multiple sclerosis. Then actually, literally, he killed us and asked, what rubbish you are saying in this tropical weather, in this Kerala, why do you conduct a program on multiple sclerosis? It is a problem of the West, in the temperate climate, in the Europe, in the America. Why should you conduct a program on it? It's an imaginary issue. Then years later, what is happening? Everybody will be seeing a multiple sclerosis at least maybe once in 2 months or something like that. That common it has become. Similarly, we are talking about autism spectrum disorder. Why should we discuss? This is a problem of some other country. Why should we discuss? We are not a party in this issue. That is not the case. 1 to 2% of the children below the age of 10 years are autistic. 1 to 2% means 1 in 50. And in India, we do not have any correct statistics for anything. Maybe I think we maybe have correct statistics about how many MPs we have or how many ministers there in the state cabinet. These are very sharp. But how many autistic kids are in India? Even God may be knowing, may not be knowing. But on a rough estimate, it is believed that there are 18 million children under the age of 10 in India are autistic. We should consider it very seriously. It's not a small figure. And even this statistics may be showing only the tip of the iceberg. So just think about it. And think about the number. If one in, as per the Western CDC type of statistics, 1 in 40 children is autistic, I think. Just think about in India, if 1 in 40 kids below the age of 10 is autistic, what will be the real number? We are the most populated country in the world. And our highest strength is the young Indians. And just think about 1 in 50 of them are autistic. So it is quite an alarming thing. And then obviously, as we were talking about, see, tasmad vigara prakriti radhishthānāntarāni ca buddhva hedu visheshamscha shighram kuryāt upakramam. Hedu visheshamscha. So obviously we are supposed to look for the hetu. Hetu vishesha. So we search what is happening, what makes a child autistic, what could be the reason, how can we eliminate it. Then there are many things. This is again only not even the tip of an iceberg, even less than that. This is a cup of ice cream taken from the iceberg. Genetics and epigenetics factors, maternal and paternal age when the child is conceived, mother's nutritional status, and many other comorbid conditions like prameham, thyroid dysfunction, staulium, then hypoxia during the delivery. This is not so uncommon. And exposure to endocrine disruptors like mercury, heavy metals, pesticides, blah, 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 blah. Many things are going on. I think we will have to think about many other factors. From my experience, I am saying. These are all selected for multiple reasons, selected reasons. At one point of time, vaccine injury was suspected as the topmost reason of autism spectrum disorder in the West for multiple reasons. One reason was that all those live attenuated virus vaccines, especially MMR vaccine, was on the most suspected villain. Another thing is that there is one chemical used in the vaccine as a vaccine, not as a preservative, yeah, some sort of to stabilize the vaccine. We call it thimerosal, which is a mercury derivative. So this thimerosal was suspected as causing autism. Lot of agitation. Anyway, I think the vaccine was taken away from this list by very systematic research. No, you should not blame a vaccine. Thimerosal, lot of consumer groups came forward, lot of agitations in America, and now there are two options. You can go for thimerosal containing vaccine or not. And for American children, we will not do any vaccine with thimerosal. But American companies will make vaccines with thimerosal that will be exported to India. That is legal. These sort of things are happening. Anyway, now about 27% of the children with ASD, a medium number of comorbid conditions occurred with the developmental delays and auditory conditions being the most prevalent. That is very evident. We can, even otherwise we can find. Another thing is that about 23% of children with ASD demonstrated many comorbid conditions with immune, gastrointestinal and psychiatric conditions being most prevalent. These are very important clues for our understanding of this, because we may not be seeing all the cases outright. So we need information from all around the world that will give us a better idea about the Vyadhi. Now, as of now, the standard of care in ASD is no cure. Then what are you doing? Doing whatever is required to manage a present condition, a given condition. Behavior therapy, communication therapy, educational therapy, family therapy, you name it, we have it. Pet therapy, gem therapy, touch therapy, holding therapy, like that, and lots of medicines as well. Now, it is with this background that we are going to discuss about the what we can do, what are our options. These are all based on our experience. Yes, this is the golden rule always. Roga madau pariksheta, isn't it? Roga madau pariksheta tadanandaram aushadham. So, we have to understand the illness first and then try for the medicine. So we have to put our brains together to understand this. These are all known factors to everyone. I am not going to say something new. We are just sitting inside a room and just brushing up what we all know. See, Sharira, Indriya, Manas and Atma. Sharira, Indriya, Sattva-atma samyoga. When we take this idea to modern anatomical textbooks, Gray's Anatomy, and look for the role of Atma in the human existence, or the role of Manas and why Sharira and Indriya are explained separately, you will not find an answer. This is an Ayurvedic perspective based on our own ontological peculiarities, epistemological peculiarities. If we have to understand these concepts, we have to understand these concepts from these premises. Don't expect somebody else to come and feed you with modern research. Then many other relevant principles, many of these things, I think at least a few of them was explained by Dharmadhikari sir. Panchabhutas, Bija and Garbha, Doshas, Dhadus, Mala, Agni, Ojas, Sattva, Rajas, Tamas, Dhi, Dhridi, Smriti, Karma. isn't it? Drishtavajaraja kaschid purvaparadhajaha tat sangarag bhavatyanyaha vyadhirevam trudha. All things are there. Now, as far as our discussion today is concerned, all other areas are important, no doubt. But I am going to focus on three focal domains: Agni, Manas and Ojas. Agni, Manas and Ojas. Because I cannot go through all the other things and how I came to these three, excluding the neti procedure, what I followed to come to this. Actually, it is not neti. I am just including all those things into this. So first we will start with the Agni. Jadharo bhagavan Agnihi. In olden days, there was a proverb. Udaram vyadhi mandiram. Udaram vyadhi mandiram. Udaram swasthya mandiram as well. Isn't it? Samapragobau doshanam sarvesham Agni hetukau. Okay, fine. So, Agni operates primarily from the gut and has a decisive role in defining the functional status of the system. Yesha saras chikitsayaha. What is that saram? Yad agnehe parirekshanam. Yesha saras chikitsayaha yad agnehe parirekshanam. This Agni influences the mental functions as well. You all can remember the beautiful explanation about Agni from the Charakam Grahani Chikitsita. It is the principle which facilitates all the conversions, transformations, processing, maturations, whatever is happening in that line in our Sharira. More than that, it prevents the entry of all external toxins by a powerful screening mechanism in the gut, very strategically positioned. Agni in the Koshta. Koshtam as such is not yours. It is an Agasham. A personally encroached Akasham. And you are doing the homam, aharam, idam agnaye swaha. Why? Then the Agni will be screening it, processing it and try to make it safe. Then only it will be taken into the system. So it is a strategical positioning. Why? By default, it is a screening mechanism to avoid dangerous stuffs. By default, it is a mechanism where Loka is converted to Purusha. So there is a very stringent screening mechanism. And trust me, any stuff which is not screened and processed and certified by the Agni will not be used for making dhadus. Even if you trespass into the system, that will be circulating as such and it will be thrown out. So that readiness to get subjected to Paka is going a very big characteristic of Ahara. Pakita, Visham, Apakicha. So Agni prevents the entry of external toxins and it eliminates or neutralizes internally generated toxins. that happens at times. Anye doshebhyeva adiduštebhyo nyonyamurchanad kodravebhyo vishasyeva vadandyamasya sambhavaha. It is an internally generated apaki visha. And sometimes we call annam itself anna visham. There also we seek the support of Agni to neutralize or process, change, transform or eliminate. And this Agni maintains the network of srotasas intact. And thus maintains a good pool of dhadus inside, keeping the kleda sanjaya in the sharira somewhat steadily clean by ensuring that the malabhavas are excreted promptly. And hence, Agni is very important in deciding the vyadhi kshamata. Now coming to the ojas, we have many stories about the ojas. But when you ask the precise question, what is ojas, there will be somebody will start scratching the head. Ojas is understood as a measure of the functional excellence of the system, which is indicative of the status of doshas, dhadus, malas, srotas and Agni. And ojas can be considered as a function which represents the grade of fineness and richness, the quality as well as the quantity of all conversions happening in the sharira. And it represents the vyadhi kshamata, and it influences the manas-sharira interaction. It goes to the basics of the sharira. Swakarma klesha choditaha sattvaha garbhas sambadhyade. So the sattva with that satma mana is used as the sattva there. That is getting into the panjabhautika sharira. So is there any basic requirement for the sharira to be the seat of that satma mana? Or samanaska atma? Yes, that is the fundamental basic supply of ojas should be ensured. From that point of conception till the delivery, and for some time beyond that, it is getting from the mother. There are many small references we can find in this regard. O joshtame sanjaradi mada putrau muhukramad tenadau mlanamudidau tatra jado na jivadi shishuhu ojo anavasthanad. Many things. So it is very crucial in the manas-sharira interaction and crucial in determining the brilliance of the cognitive functions. However bright and brilliant the manas is, the buddhi is, if there is no proper ambience created by the ojas, it is going to be a dangerous buddhi. Either it will not manifest or will manifest in a distorted manner. Now coming to manas, which is the I, me and my factor. Ahankaraha, which is responsible for many faculties like thinking, imagination, discrimination, many things, introspection, retrospection, prediction, anticipation, judgment, comprehension, emotion, all these things. In short, manas represents the cognitive sum of an individual. And there are three basic faculties connected to the manas: dhi, dhriti and the smriti, which is very, very important, together called prajna. Prajna. That is what we are. I am is my prajna, not this sarira. What I am is my prajna. Dhi is the capacity to appraise an event or situation logically. All these things everybody knows, I am not going to the details. Now, sattva, rajas, tamas decides the nature of manas. These are all common with everyone. Everybody knows it. Again, I am not going to it. This sharira manas duo, though two different entities, they work in tandem, in perfect match. Then only the things will be on track. And they complement each other, share the good, share the bad. Sattvamanvidhiyade shariram. Manas sharirayostava parasparam abhivrajed adharadheya bhavena taptajya ghadayoriva. We all know these things. Now, we highlighted about three things: Agni, Ojas and Manas. We propose that these three things work together to form a system. In everyone. Agni, Ojas, Manas. They complement each other. They support each other. They are interconnected. They work as a system. Now, I put it as AOM. Agni, Ojas and Manas. A system called maybe Om. A system in Sharira which works as Om. And if there is an error in any of these components, is going to affect the others, and that will disrupt the system. Any disruption, when that system fails, there is an issue. And when the Om is disrupted, there is a mismatch between Sharira and Manas. Then what happens? Many things will be happening. Agni is disturbed, Ojas is disturbed, Manas is obviously disturbed. Agni and Ojas, maybe if you put it on the body part, Manas is on the other part, then that link is broken. System fails. We saw that what all each ingredient is doing. Body is slowly getting accumulated with the toxins. The internal environment is getting polluted. What happens? That is reflecting in the indriyas. Perception is going to be disturbed. When the perception is going to be disturbed, mind will be translating it in a faulty manner. Mind is going to report to the buddhi in a distorted manner. This is going to affect all cognitive faculties of Dhi, Dhriti and Smriti, and as a result, karmendriyas are given with wrong suggestions. That is ending up in many things. This AOM system works with everyone. If it is ulcerative colitis, it is another type of disruption. If it is liver disorder, it is working in a different manner. Everywhere you can put this idea. There is a disruption between the AOM system within. And here in our context, this is going to manifest as various things, including the diagnostic characteristics of autism spectrum disorder, various types of behavioral issues. And in ASD, if you look properly, you can find representations related to all the components of AOM. Say for example, faulty Agni, there will be poor or altered or erratic appetite and hunger, fussy eating, pica type of lakshanas, bloated, gassy stomach, frequent burps, belching, pain abdomen, nausea, vomiting, constipation or diarrhea, and inconsistent stool, sometimes frothy, mucus, undigested, stinky, and changes in the body weight, sometimes obese, sometimes poor weight gain. Regarding the faulty urges, tiredness, lethargy, lack of enthusiasm, falling sick with infections frequently, executive dysfunction, fear, anxiety, impulsivity, depression, inertia. All these things can be seen in different grades or sometimes picking. Some of them are there, some of them are absent. These are all based on the grades of the involvement of one component. Regarding the manas, learning disorders, irritability, impulsivity, many of these things overlap. Now, with this understanding, what we can do to manage the management pattern? While planning, so rogamadau pariksheda tadanandaram aushadham or dosha aushadha nirupane. Now, regarding the management strategy, we have to identify the issues first in a given case. We have to target to reduce the functions fundamentally, then only the child can be managed. Avoid or minimize the support needed for daily life. That is a big problem. That is a big problem because it is not about the child alone, but about the entire family. Then, sometimes, as I mentioned earlier, because of the untraceable nidana vishesha, sometimes some conditions may not be reversed, cured completely. But even in that case, we should be able to manage it, make it manageable, symptom alleviation, improving the quality of the life of the person involved and the persons around the involved person. And as far as Ayurvedic tools are concerned, they are active. What is active? Means not passive. Means everyone is a part of the program. It is not just like ill-pill equation. The entire family is a part of the program. All caretakers, teachers, even the neighborhood, everybody related is going to be a part of the program. So it's a very actively involved program and it does not contradict with any other therapies like special education, speech therapy or occupational therapy, many other things. Why they are important? Because you see, one child called X is having an ASD, he is of the age of 5. He has lot of things which makes him quite a back from his peer group. Now we are treating this child, we are making him perfect. It took 3 years, by that time he is 8, his peers are also 8, but he will be still emotionally, cognitively, intellectually, he may be still maybe in the age of 5. The other peer group is not going to wait. Let Mr. X come, we will stand here. They are moving. So to bridge the gap between the involved child and his peer group, we need to push. So speech therapy is important, special education is important, occupational therapy is important, everything is important. And Ayurvedic management is purely based on the internal environment of the child. It never contradicts with all these things which are going to be supportive. And the focus on environmental factors and their modifications give better possibility of symptom management in every case, and the management of symptom in one area effectively will open up the possibility to manage many other symptoms in many other areas. That is one big advantage that we have seen. But there are lots of challenges. Challenges regarding the complex presentation of the case. These days there is a tendency to overdiagnose cases as autism. Ideally, see, if the child has jumped on a day out of excitement, the next day he may get a diagnosis of ASD. That is the situation these days. So overdiagnosis is a problem, underdiagnosis is a problem, delayed diagnosis is a problem. Comorbidities, lot of comorbidities. Epilepsy may be the reason why the child is brought to the physician. Then only we will be understanding there are many other features which are showing the characteristics of autism, but when it is cannot be diagnosed as an autism, because purely in autism should not have any other things which can be attributed for this presentation. Then only if we have patience and thorough understanding of the basic, then only we can isolate and group these symptoms to the AOM system. Otherwise, we cannot put this into practice. Then socio-economic issues, competence of the parents, involvement of the parents, socially stigmas, many things. Now, in our protocol, the process is initial assessment based on the Ayurvedic OM system. Then we also use Indian scale for assessment of autism called ISAA. Parent counseling, explain the protocol, generate the initial prescription, timely reviews, assessments and changes in the prescription accordingly as and when the child is improving. I am not going to the technical details of ISAA, I am skipping it, which is an objective tool developed by the National Institute for the Mentally Handicapped. There are 40 items, which is more like an observation and a questionnaire. There are 40 items, like which is divided into various domains. Now, technically speaking, score less than 70 is normal, 70 to 106 mild autism, 107 to 153 moderate, and more than 153 severe. In our protocol, which we call as Supra or Sunetri protocol for autism, it has got 3 phases. First is to correct the Agni. That is the fundamental thing that we have to achieve, and it is the toughest thing to achieve. Phase 2, cleanse the system including the Srotas. Phase 3, enhance the Ojas and fine tune the Manas using Aushadha. The first one is a home based program. We will give them a time of 3 months in which the medicine should be started, the dietary modifications, other environmental changes we require, all these things should be implemented 100%, and timely reporting should also happen. There is a diet at that time which we start, which is as traditional as possible, as local as possible, as homemade as possible, which is gluten and casein free. Gluten and casein are 2 proteins, interestingly. Gluten is a protein which is seen in some grains, and including wheat and oats. And casein is a protein which is seen in milk and milk products, except maybe ghee, khadam. This is not the fault of wheat or dairy products. We have spoiled it. Out of greed, we changed the nature of wheat. We changed the nature of milk. Kshiram, we find that okay, it is rasayanam uttamam. But what you get today is not uttama rasayanam, which is a very dangerous fluid, which we use as the tea whitener. No other qualities you expect from the kshiram these days, even though it is labeled as kshiram. Same is the case with the godhumam. Godhumam is having wonderful effect in the Ashtanga textbook or Charagam textbook or Sushrun textbook, but not in the godhumam what we get for consumption. Because it is not godhumam, it is a visham in disguise. That much things we have changed regarding the godhumam. World over, wheat related health issues are skyrocketing. Wheat related health issues. Then refined sugar, junks, chemicals, additives, tastemakers, colors are avoided. How can we live without all these things these days? That is going to be the biggest challenge. Then medicines, basic Ayurvedic preparations which are focusing on the Agni, but some basic things, Amrutotram Kashayam, Chirivilvadi Kashayam type of things. From Kerala we are having an obsessive disorder of prescribing Kashayam for everything. Vishahara type of drugs for the Dhadu Shuddhi. Krimihara, Anilobana, Agnidipana. This is the core concept as far as the prescriptions in the initial stage are concerned. Now the phase 2 is a hospital based program. There the caretaker and the child stays with us. This is for 2-3 weeks. Diet and medicine will be continued as such, and classical therapies will be done, including a few modified versions of Shodhana Chikitsa. This sort of Abhingam, then Shirodhara, then this sort of Murdhalepanam, we call it as Talapodichil in Malayalam. Then lots of Vastis, Dhupanam, then Nasyam, modified versions of Vastis we use in plenty. So they are the therapies we generally use. In the phase 3 is to enhance the ojas and fine tune the mind, where Medhya Rasayanas will be used, Kritam will be used, and Suvarnam in Prasham form or something like that. Only in the third phase. There is a general tendency that somebody is coming with ASD, immediately Saraswata Arishtam is prescribed. Saraswata Arishtam, the Medhya Chikitsa in Ayurveda starts with the Saraswata Arishtam and ends with the Saraswata Arishtam. That should not be the case, please. Now, during the follow-up period, diet and some basic medicines along with the Medhya Rasayanas will be continued. Regular follow-up is advised for parent interview, examiner observations and scoring with the ISAA. This second and third phases will be repeated. Hospitalization and Medhya Rasayana Prayogam. First will be maintained all throughout. That means some basic medicines and diet. This is a case under Ayurvedic care which I am not going to elaborate in detail, but I will give you the crux of the story. Yeah, this was a 6-year-old boy, but actually this is an old case. We finished this case treatment in 2023 early, I think. He is normal now. Yeah, so initially you can find that we started the treatment with an ISAA score of 110, and he had 3 admissions. If I am right, he had 3 admissions. And yeah, this was one area where he came out of the spectrum technically. Still he had some problems of some minor behavior problems. Yeah, it came to 44. And this is that graph which shows the change in ISAA from 110 to 44 in 7 reviews. And we have some observations over the last 20-22 years regarding the management of autism. What is that? Actually, these pictures in the background, they are drawn by ASD kids and put into a calendar format by an organization called that rainbowbridge.org.in. Yeah, factors influencing causation: Bija, Bija Bhagadushti, which can be Sahaja and Kulaja. Parents with similar, maybe milder versions even, symptoms in their childhood. We have to be very careful asking these questions. Sometimes these parents, father or mother, may have milder forms of presentations in their childhood. You have to strategically ask with their parents, that means the grandparents of the present child, how was your son during the childhood? Then she will say or he will say, he never used to sit in a place for a while. Then how can you expect his son to sit for a while? But that person might have outgrown that sort of issues. And he may be performing perfectly. He may be a CEO of a multinational company now. But there is a possibility. I have observed many cases. Then, Matrija Ahara Vihara, including mental activities, unhealthy, unfamiliar, junk food, bad eating habits like late dinner. I think sir was saying it. Intermittent snacking, untimely eating, stress eating, and recently living inside the screen, not outside the screen. Yeah, increased screen time and screen addiction, overexposure to radiations, maternal and paternal age, first child with ASD. These are all can be risk factors. Sleep deprival during pregnancy, habits like smoking, alcohol and other intoxicants, severe mental stress and trauma during pregnancy, lack of emotional support, overwork, lack of rest and relaxation, overloaded medicines and supplements during pregnancy. That is why I say that we saw only 4 or 5 items in the beginning in the standard literature. I have isolated many more from my experience. Visha, medication, certain types of vaccines, toxic industrial waste including heavy metals, fortification of foods with chemicals. I do suspect that is unnecessary addition, value addition. Fortification of normal rice, salt and many other things with these chemicals has changed the internal environment of human beings. They are no more Homo sapiens. Some Homo chemicalis or something like that. It's a new species evolved. But we do not understand because everybody has changed. Then soil pollution, chemical pesticides, artificial food additives, etc., etc. Now, there are certain factors which positively influence the treatment, which are helpful. Number one, no comorbidities. Not on any psychiatric medication. Generally, these children are put on heavy psychiatric medications irrationally, unethically. Parents with the patience, commitment and enthusiasm is a big support for the treatment. Parents with a good observational skill about the child. Generally, they are driven by frustration and anxiety. But if there is a neutral parent, things are much, much better. Strict compliance to the protocol. Excellent family support. Optimal or proper social exposure. Because many things are learned, not taught. We think that everything should be taught. It is not like that. Proper support from the imaginative therapists. Therapists are there like mushrooms. But imaginative therapists who can customize a program for a child. Yojagas tatra durlabhaha. That sort of yojagas are very, very rare. Prioritizing the concerns and working on that basis. We want to do everything in a week. But child is not toilet trained. He is 10 years. Please, for next 3 months, focus on toilet training him. Protocol, diet, medicine and everything. But your effort, next 3 months, achieve one thing. Get him toilet trained. Forget about the rest of the things. Many times once he is toilet trained, lot of his anxiety related issues will subside without any effort. Then neurotypical elder kids, especially girls who can work with the child. They are so amazing. They can do wonders in the healing of the younger siblings who is affected by ASD. Rural mothers are much easier class to treat for their children than the urban folk. Very sorry to say it in Pune. Factors adversely influencing the treatment. Parents who are on psychiatric medication, parents, over-informed parents who keep on Googling and trust everything. Trust everything. They will not say that I am trying another 10 patis. They will be doing all this thing and the poor child will be getting overloaded with medicines and toxins. Over-informed parents who keep on Googling and distrust everything. They have not trust in anything. That is equally dangerous. over-anxiety, depression of parents who deny to recover from the trauma of the initial diagnosis. That is a big challenge. Poor and partial compliance, looking for quick fixes, unrealistic expectations, overburdening the child with the therapies, morning 8 onwards, night 8, full packed, 1 hour, 1 hour, 1 hour, 1 hour, 1 hour. That therapy, this therapy, there is a new gem therapy, there is new pet therapy, there is a new dolphin therapy. Opting multiple protocols simultaneously. Last week they might have started a new thing they will not disclose, and this week they are coming to us. Expecting that the other doctor offered 3 weeks for the first review. If this is added on, maybe in 1 week itself we can expect miracles. Opting multiple systems without proper assessment, sometimes it turns out to be dangerous. Highly structured living or educational environment or lack of spontaneity of children. That is the modern standard. Yeah, this is one thing which I am spreading everywhere I go in a mission basis. Respect your food and avoid phones while eating. We are into it, slaves. And if you find any mother or father or grandmother who can feed their grandchildren without the help of mobile phone, please inform me. I would like to see such a person after a long time. It's very difficult. And my humble message is, avoid screens while feeding your child, because they are manifestations of divinity and they deserve much, much more than what we see on the screen. After this lockdown, you see, everybody may be knowing the